Hi, welcome to today's segment of OurVentura TV. My name is George Alger. Today we're going to be talking about pain management, and our guest expert today is Simone Fortier. Welcome, Simone.
Thank you.
So what is pain management?
Pain management is looking really at a global view of what people are going through after injury, and also looking at really what's causing the pain. And pain for each person is individual. And oftentimes, when the person is stuck in chronic pain, they feel that people don't understand that. And so where we look at kind of managing that is going and looking at, again, the global view. What's causing the pain? And with that, we start to look at the fascia.
And what is the fascia?
The fascia is really the system in the body. It's a structure that connects everything together. And what that means is the lymphatic. It connects the muscles, the skeletal system, all the cells, and it holds.
So it's physical.
It's a physical structure. And what's interesting is that it really wasn't addressed in anatomy books before 2007. The first Congress of Fascia was at Harvard in 2007. It was dissected in its entirety in 2011. So it's relatively new, but it's one of the most important structures in the body because of that connectiveness. So I'm going to do an analogy, because everyone knows what Facebook is, Instagram, LinkedIn. Well, those kind of represent systems in the body, the muscles, the nervous system, and the skeletal system. So those are kind of like that model, but the fascia is the internet. It connects everything together and communicates really everything that's happening in the body to the brain instantly. And they've now shown that it actually goes to the brain faster than the nervous system. So it is really, really important to pain, because we're looking at the whole system, not just a segmented model. And when people and practitioners are looking at the segmented model, they're like, oh, my shoulder is painful. Oh, my head hurts. Oh, and when they do that, it actually, well, everyone wants to go treat the symptom. And so they treat the symptom, which then oftentimes doesn't create lasting change. And so then people get discouraged because they're like, they've had people work on their shoulder or their calf or their Achilles or whatever for 5, 10 years, and it keeps coming back because they're treating the symptom of the pain. And usually everyone's like, yeah, you know, this hurts, but it's often not the cause. So looking at really what's causing the pain is really looking at the fascia. And that goes into very different levels. So that goes into posture. What caused the injury in the first place? What's causing the chronic pain? Why is the nerve always firing? And by taking medication, may just mask that, so then it creates other injuries or side effects long term. So we want to go to really the root cause.
Now, is this type of pain management through the fascia something that individuals themselves can incorporate into their lives, or is this something you need to address through a specialist?
Well, initially, you would have to get it assessed. So looking at where those lines of tension are in the body and releasing those. But there's a self-care program that people can do themselves, because when you want to open up the fascia or release it, it's very different than yoga or other different modalities. There's a tempo to it, and it also is very slow. So the rehab exercises actually re-educate the body, but they're very specific and they're so easy to do. People can't believe that that would help them.
Okay, so then as a simplified look at this, would it be accurate to say that the type of pain management that you're referring to through the fascia is a type of exercise routines?
Movement.
Movement, okay.
Yeah, it's more movement than exercises, but it engages the lymph, the nervous system, all the systems in one to really open up, and because oftentimes like people will get swelling or inflammation, and the lymph could be congested. So you could address the lymph, but if the fascia is restricted over the lymphatic vessels, then you could get the lymph moving, but still it will be congested because the fascia hasn't opened up to allow that lymph to move through.
Okay, now would you say that this type of pain management falls under a general category of natural health?
Well, anything to do with the body is natural health, and it is optimal way to go, because if you can do everything without introducing a toxin such as a medication, it nudges the body to start healing itself, because the body knows what it needs. It just needs a nudge. Sometimes it gets stuck. So oftentimes people, again, don't get better because their brain is stuck in fight or flight. So that means if you're running from the bear, you're not going to take time to heal. And so that stress could be the trauma of the injury. It could be post-traumatic stress disorder, because the injury created now an inappropriate response to normal stressors. And so the body's just stuck in a neurological loop. So we want to take the body out of that first. And to do that, the fascia is involved with that, and the lymphatic, to really calm the brain and the body down, and then the body can heal. And so again, you have wonderful practitioners doing great modalities on people, and then people get discouraged because they're not working. And they're like, why aren't they working? Because the brain's still in fight or flight.
Okay. Can you run us through an example of this in life?
Well, you know, I've seen so many people. I actually had one lady fall out of an airplane and her parachute didn't open, and she is stuck in chronic pain, but her whole spine collapsed, but her legs didn't break, but the fascia was so restricted. And she was going to the Chronic Pain Institute and going through that whole program, and she was referred to the fascia work 3 years after, and her response to that was she was out of pain. She was out of that neurological loop. And it was the fascia opening up so the nervous system could release and the muscles could release. So there is a hierarchy to healing, but that's an amazing example. Now the lady is functioning, her headaches are less, but she was in chronic neurological loop because the packaging of the body, which is the fascia, and it's around every muscle and every organ, was like concrete, because it just went into a protective mode, and there was nothing telling it to open up. And the fascia does actually manually have to be opened up. So it stretches in certain directions, but not in others.
Can you comment on the amount of time that these exercise movements take to release pain?
So unfortunately, once somebody has an injury, they do have to do self-care. And it's usually every day is optimal, because the more you move and the more you keep everything open and fluid, the less pain you have. So motion, movement is essential. But when people are in pain, they don't want to move. So it's counterintuitive. But once they start moving, and then they go through that initial short period of pain again, and then they go to the other side, they're like, oh. But here's the thing that's really interesting with people. We get them pain-free, then they stop doing the exercises. So how do we get people, when they're pain-free, because that's the great motivator, to keep doing them to prevent pain in the future? And that is really, the people that do that stay pain-free long-term. And I have an example of that. I had one gentleman, he was 70. He had 3 herniated discs. We opened up the fascia. He was going for MRIs, epidurals, this and that. He stopped all that, opened up the fascia, does the exercises every day for a half hour every day, and he has maintained, one, he can play golf still, and he can golf his age, and he has not had that pain come back. So he's dedicated to doing the exercises and the movements daily. And it depends on the person. If they're mobile and if they're moving all the time, then they might have to do 10 to 15 minutes a day. But it's an investment in your health. And so I lecture people. I'm like, if you do this forever, it's not just until you're pain-free. It's not just a month. It's not just a week. It's long-term, because the injury is there and it's permanent. So there's scar tissue, there's adhesions, and so the more we sit and not move, the stickier our body gets.
Yeah. Now, what would you say to someone who just might be more interested in taking drugs?
With the drugs, what it does is it breaks down other systems. So the liver, the pancreas, the kidneys, and there is always a side effect. So how drugs are used optimally is to get someone out of acute pain. So it's necessary to stop that inflammatory process and to also get the brain calmed down. But it's not optimal for long-term use, because then the body adapts to it. Then you need more. Then you need to change your medication, and then sometimes the medications just run out. There isn't any other choice. So by that time, your body is really toxic on the inside. So it's just creating a lot of different issues that promote actually more discomfort in a different way.
Okay. And how would someone get introduced to this? I mean, is this something that a doctor will often suggest, or is this something that a person would really have to find on their own doing some searching?
You know, what I'm finding is actually there's a lot of research now online on fascia, and and the New York Times did an article on fascia like probably a few years ago. I don't really remember the date of that, but I think it was about 2008. And since then, it's become more well known, and practitioners are becoming aware of it. But what I'm doing right now is actually writing letters to medical doctors, because with concussion people, there's a fascial component to that, and there's a chronic pain component to that. So 80% of the people who get concussed get better. There's 20% that don't. And usually their brain is chemically altered already, so they have ADHD, they're have compulsive tendencies or overachievers, that sort of thing. So their brain's already different, and those people, their concussion symptoms don't go away quite as easily. So with that, it creates a whole pain cycle. And with that, working with that, the fascia can actually create more space in the brain and reduce those symptoms.
Okay, so we're just about out of time here. Simone, can we get a website that viewers could go to for more information? And do you have a summating message for the viewers?
Sure. The website is the fasciatraininginstitute.com or SimoneFortier.com, if you can spell that. And the message is, when you're stuck really in chronic pain, finding really the best solution for you would be to look at globally what's causing that. Even if it was started by an initial injury, it's how has your body changed, what's compensating, and start unraveling that and getting your body really out of fight or flight so you can start to heal. That is really the primary message. You have to be in a place really of relaxation for your body to start to heal and all those modalities to work.
Simone, thank you very much.
Oh, you're welcome.
This is George Alger signing off for this segment of Our Ventura TV. Until we meet again.